Dr. Rolf Ehrhardt, CEO of Medcision.
Now, my background is in immunology, clinical immunology, cell biology, and preclinical and clinical drug development, in particular biologics. And we just started Medcision with the idea to really automate simple, basic processes in the clinic. We believe the clinic can really benefit from automation. Thank you, Tim, for organizing this session. Thank you to the organizers for giving us the opportunity to talk about last mile challenges. I agree, there are so much activity going on right now in cell therapy. It is probably time to get a bit more serious about last mile and how we're going to tackle this. So the organizers, and I believe Tim gave us the following homework, how to solve the last mile problem, how to ensure temperature control, how to deal with multiple thawing solutions, how to improve upon the water bath. I will focus on that mainly today because that's what our company is focusing on. And it's an easy one, of course. I'm excited to talk about this. And last but not least, how to develop a robust SOPs for healthcare professionals. So believe it or not, there are more than 5,000 stem cell therapies, trials ongoing in clinics globally, about 90 CAR T-cell studies in the US alone. And as I said before, I think it's time to get serious about last mile risk and last mile standardization. The four major issues I see with the last mile is safety and efficacy, especially as it pertains to differentiation, cell differentiation, whether it's inappropriate or appropriate, antigen specificity, organ specificity, and how to maintain homing factors. The next one is, of course, scaling up these trials as they progress to phase 3 commercialization, global rollout, and of course, how do we deal with the data? How do we extract data? How do we monitor and manage it? Another big point regarding safety is infection risk. Both the FDA and the CDC have now issued warnings regarding bacterial infections known to be associated with water bath systems. Cardiovascular surgeons are very well aware of this, and we believe the FDA, it's just a matter of time when the FDA is starting to ask questions about water bath system in cell therapy. And the other issue, of course, scalability. I think we all agree that scalability requires very robust SOPs. And we at Medcision believe the best way to implement these SOPs is through automation. Automation reduces errors and implements consistency across multiple sites. We and others believe thawing is one of the most important or critical steps for live therapeutics post-manufacturing, and because of this, we think you gotta automate thawing in the clinic. So why are we still using with our high-value therapeutics that take 10 years to develop or more, why are we still using these archaic, non-standardized, unsafe methods while there's already new technology available? Technology that can make these processes simple, safe, scalable, and gives us data. We at Medcision have developed the first fully automated thawing solution platform that truly allows you to one-step operation. What does that mean? You don't have to dial in, you don't have to write SOPs around it. You just put the frozen vial into the device and the sensors inside the device sense the phase change in an algorithm, customized algorithm, calculates the remaining thawing times. So this really guarantees consistency, very little human error, and it also allows you to customize each thaw according to your SOP, according to your therapeutics, according to your cell, according to your media. And I will talk about this in a minute again. So such automated system gives you really consistent thawing, something you never see in a water bath, no matter how well trained your technicians are. And we've seen this with other laboratories, other companies over and over again. They have trained technicians for 5 years on the water bath, and once in a while they still get outliers. So with the automated system, you get superimposable thawing curves, here shown with a 6 ml aseptic vial, 4 test runs. They're basically identical thawing curves. In addition, most of the time you also get much improved cell viability and recovery. This was also done with several labs that had already standardized the water bath system over the years. So what we hear over and over again from labs or companies, non-standardized thawing methods have really resulted in low viability, altered cell subset recovery, low proliferation rates, reduced cell function, and increased cellular stress. So really something you don't want to deal with when you ramp up into phase 2 or phase 3 or even commercialization. And a few more words about the algorithm, why we think the algorithm is so important in our system. We have shown every time you change the cell, every time you change the media, every time you change the vessel, the glass, on and on, you will require a different thawing curve, a different thawing time. So we can actually customize the ThawSTAR according to your cell therapy, your cell, and your cryopreservative. So very important. And of course, we recognize that connectivity is really important. Another thing you can't get with your water bath, you can't extract data from your water bath, of course. So we're working with software provider like TrackCell to integrate our instruments in their connected service programs. We think, of course, that's very important. Another thing we're very excited to announce is a program for all late adopters. We are announcing an early adopter program which allows you free of charge to integrate our products, our instruments into phase 1, phase 2. So the question is, what do we need to do in the last mile, and why aren't we doing it? Why aren't we more concerned about automation? Why aren't we more concerned about eliminating contamination risk? How do we protect the safety and efficacy of these drugs? And how do we develop customizable yet scalable solutions? And of course, how do we connect all these devices in the last mile so we can do data tracking and management? Okay. Thank you very much.
Thank you, Jeff.